Okay.
It's just a rearrangement.
Yeah, so the question, you caught me out. So he's saying, well, it's not really a volume expansion if you only ate salt. Well, realize I took a liberty. The way Costanzo has this set up, I think she means to imply that when you ate salt, you also followed it with some water too. But you are correct. The way that I set this up, just adding salt, it's not technically a volume expansion.
Right. Okay.
It's a volume redistribution, but not an expansion.
Okay.
Yes, correct. So you caught me out in an error, kind of.
Well, I was just
No.
just in a big picture.
No, it's good. It's good. I'm not criticizing. I think it's great that you pointed out that I sort of semi-screwed up, didn't I? Did I screw up wrong? Good answer.
Oh no,
About
you lost me, so.
I haven't lost you?
No, he kind of lost me.
Oh. Don't worry about it. Okay. So let's see where we are, and we'll see when we want to take. Can we get through this page and then maybe take a break? Yeah. Okay. So we're on the next. We just did fluid shifts, and now let's look at fluid administration. And what I've done is I repeated case 1 and case 2. So case 1, remember this was the little guy who had a plasma sodium of 121. How did we decide we're going to keep this young man alive? Saline, yeah. Yeah, isotonic saline sounds like a real good bet. All clinics vary a little bit in their protocols, but probably giving saline would be a pretty good thing to do with this guy. One, because if sodium loss is leading the water loss, then we probably need to give sodium back. And so isotonic saline is a good way to go. And I think we did note that isotonic saline is probably a little bit hypertonic to him. So that's good and easy. What about the second guy? He's got a plasma sodium of 170. And let's just assume that he's not in serious condition. We just like to replace this. How would you do that? Half normal saline? Possibly. Yeah, and you probably read down a little bit. I mean, your answer's not a bad one. I mean, it certainly needs to be less saline. And there may be situations where that would work. So, yeah, so let's talk about D5. What is D5? It's dextrose 5%. It's... why not just give water?
Cells and lice.
Yes, cells will lyse. Not good, huh? Okay. Certainly locally at the injection site, yeah, you don't want to give pure distilled water. It will do some local damage. So what D5 is it's a kind of sneaky way of giving back pure water. So here's how it works. The dextrose going in is pretty close to isotonic. And so isotonic, no problem. The dextrose is taken up very quickly and metabolized. And it's gone. So what's left is water. And now it's mixed with everything else, and so it doesn't really matter, okay? So it's not going to cause any problems. So, yeah, D5 is kind of a way of giving back water. Yes, ma'am.
Could you give that to like diabetic patients? Would that cause any problems if you're adding?
So the question is, would I give dextrose to a diabetic patient? And your first thought is, gee, you don't want to give glucose back to a diabetic patient. But actually, it is part of a normal protocol. Okay? So maybe well, depends on this. We'll get into severity later on. But yeah, actually, the protocols for diabetes will often include dextrose, at least for follow-up. Okay? So I'll talk a little bit more about that later too, I think. Maybe I'll just leave that. Oh, well, let me just give you kind of a hint. This was one of Dr. Wattod's cases about 30 years ago. He said, Brian, you know, I looked at this patient and I gave him quarter-strength saline and D5. He said, I'm kind of apprehensive about giving this guy D5. And so there's obviously a clinical judgment reason for doing that, and we're going to discuss that a little later, okay? So we're going to try to distinguish between replacement and maintenance and then resuscitation, okay? So fluid imbalance can get so bad that you've got to do something stat. Okay, so I'll talk a little bit more about that later. So then down below that, we talk about intravenous fluid replacement. And the first thing that I would note is that there are basically two types of fluids. One is crystalloids, which is just what it sounds like. It's soluble crystals dissolved in water. And the other is colloids. Blood is technically a colloid because it has suspension of proteins in it, okay? But a colloid is something that has a suspension of particles in it that tend to be large molecular weight substances. And I'll talk a little bit more about what kind of colloids we might use. But first, let's talk about the crystalloids. I've given a whole list of them there. Really, the ones that at this stage that I'm most interested in was what we talked about, the normal saline and the 5% dextrose. Because even though they may not, in all these cases, be the only thing that's used, they kind of make sense for us at this stage. There are a whole bunch of different solutions. There's also Ringer's lactate, which tends to replace other substances besides just sodium and chloride. And there might be, if there's prolonged losses, Ringer's lactate might be appropriate. But just in general terms, we can focus on normal saline and dextrose. So what I thought that I would do, and then you go to Britain, and then they got all sorts of different other concoctions of intravenous fluids too. So, and actually looking at this list, some of these are used more nowadays and some were used 30 years ago. So, yeah, it's very variable. So let's look at this Mr. Good thing. And I think you remember the first part of it, and you remember that he had a sodium of 157. So, and I don't know whether any of you did this in CBL. So, we need to give him dextrose, right? Doesn't that make sense? I mean, he's got a sodium of 157. He needs water. And so D5 would make sense, yes? So the physician, I inserted a catheter into his arm and infused 1 liter of isotonic saline. Did the guy screw up? Of course not. You know he didn't. Any clues as to why this is significant? This is really worth something out of the bowl. Nobody knows, huh? I get to eat a candy. Am I still clicking? No. This guy is at 157. He's pretty severely dehydrated. So, could he die? Sure could. So, what would of what? I mean, at severe levels of dehydration,